So 1,700 people didn't get violations on Twitter and taken down. One person did. So there must be people amplifying, saying, I don't like their message, so let's target these individuals. And then Twitter responds and goes, we've got complaints. It meets an algorithm. Let's take it down. Now, that particular amplification is censorship, because people are censoring ideas by complaining and saying, can you take this person down? In effect, when you think of censorship, what else is happening is, and this is a big thing in academia, is I consider now there's a problem with self-censorship. You suddenly have to withdraw a bit and go, well, what can I publish? What can't I publish? And the people around you go, well, I ain't going there. I'm not going to retweet this article. I'm not putting it out there because I fear for my job. What happens is they come back at you and say you're a public health threat because of the messaging you're putting out there. So they attack the messenger, not the message. The headline is, Heneghan says there's no second wave. And that's how it gets completely shifted in a way. And you go, I haven't said that. I've just said to you, here's a definition of how you might look at it, and here's how you might think about it. I still think that's a valid definition. Some of the newspapers that were coming after me, I was a bit like, this is too much to handle right now. If I was to put a statement out there that said aspirin is of no benefit in secondary prevention or in a heart attack, I'd be going against guidelines. I'd be going against the profession, and it'd be right for me to take that information down because it's misinformation. But if I put it against primary prevention, it's information. It's helpful information. The question is, who has the skills to understand and interpret what I've just said? Because what's happening with these fact checkers is that people out of a science degree who basically just would not even understand the nuances of what we've just discussed. So I'm saying there are different ways to manage this pandemic that are completely at odds with the public health strategy that we've got in place. For that, you may get censored.
Welcome, Carl, and thank you for joining us today.
Hi, Lucy. You're welcome.
So in November 2020, you accused Facebook of censorship for branding an article that you had done on masks as false information. And recently, Twitter put fake news warning on a newspaper article about your study that found Britain's COVID death toll may have been lower than previously thought. Can you just tell me a little bit more about this and how you felt about it?
So we published an article going back to November 2020 about face masks. But just today, it's really interesting because on the environment is totally different today. I mean, I'm reading a San Francisco Chronicle that says 4 COVID experts say it's time to accept reality. Vaccine work, masks do not. Now, that type of headline that's out today, if that was out 15 months ago, it was considered that you were a public health threat and that actually that's the sort of information that should be taken down. Now, just to give you the backstory, I work with Professor Tom Jefferson, who's led for about 20 years the Cochrane Systematic Review on Non-Pharmaceutical Intervention. He'd done the update early in the pandemic, and we were aware of all the ongoing trials and what the trials show from influenza-like illness and what was happening with COVID.
The Cochrane Systematic Review is one of the best out there.
Yes. Yeah. So one of the important aspects of evidence-based medicine is to inform decisions. You do that with high-quality evidence. And the highest quality evidence is randomized controlled trials, where you randomize some people to the intervention, in this case, masks, and other people to a placebo when it's a drug, or in this case, no mask. And there's about 9 randomized controlled trials that have been done prior to the pandemic. And they all pretty much show the same thing. There's no effect, and there's no effect of wearing the mask in the community, and there's no effect on source control. And this includes studies that have been done in like the Hajj, where they've worn them in the tent at night, and it still didn't make a difference. Now, what was happening as well is there's been a trial that was being done in Denmark called the Denmark trial, and we were aware of that trial, and we were also aware that it was having problems getting published. It seemed to be keep getting rejected. And so it took a long time from the trial completing to it actually being published. And it came out in November, exactly the same time as the update of the Cochrane Review was coming out. So we understood all of that evidence base, and we put it out there and asking questions, saying the significant uncertainty. Not only is the uncertainty a problem, why are we doing so few randomized controlled trials? What we were using is particularly observational data, which doesn't intervene. You just watch what's happening. So you go to a certain state and you'd say they're wearing masks, the cases are coming down. Therefore, the relationship, there's an association between masks and the outcome of cases coming down. And people were using that to imply that's what was making the difference. Whereas most of those studies were looking at the seasonal effect, that we were going into summer and we decided to intervene at the top of caseload and then coming down. So we wrote an article based on that wide experience, pushing the boundaries to say there's lots of uncertainty. It's still not clear what the answer is, but there's a complete failing of the evidence base not to put out there more randomized controlled trials. In doing that, we wrote the article, and that article went widely at the time. It was widely pushed on social media, widely picked up in the wider media. But what happened is people posted it on Facebook. And as soon as they posted it on Facebook, it started getting a message of concern on it. And I tried it, and it basically said, you are violating Facebook's rules on COVID misinformation, and therefore we're putting a warning on this post. And that's the first time I really understood that there's in the background an issue of censorship when people perceive you're putting up misinformation.
Was that potentially a mistake by Facebook? Did you try and question it? Who had decided it was misinformation?
Well, I think if you look at it, you see many of these entities like Twitter and Facebook had a policy for violation of the policy in light of COVID. And this is particularly interesting. They say in order for content related to COVID-19 to consider violate under this policy, it must advance a claim of fact expressed in definitive terms, be demonstrably false or misleading, based on widely available authoritative sources, and be likely to impact public safety or cause serious harm. Now, there's an important point there, which is what they were using for their facts were the authoritative sources. So at the time, if you go to CDC or you go to the NIH or you go to the UK government, they're saying masks work. This is the facts. Now, we know in terms of evidence-based medicine that opinion at that level can be misleading and has been misleading over time. So that's not the facts you should be going to. You should be going to the evidence base. And the highest quality of evidence is systematic reviews of randomized controlled trials. So this has been the distortion. And it reminds me a lot of why people get involved in evidence-based medicine, because they see differences of opinions and say, well, how do we resolve this difference? Well, if you've got low quality evidence, what you find is people's opinions dominate, and authoritative opinions can dominate, but they're not necessarily correct, because high quality evidence as it emerges can overturn that opinion. So I think there's been a key error in how social media has pursued what it considered is the facts, which has led then to considerable issues with censorship, which is creating a big problem for the social media giants, but is also providing a big problem for society because they are becoming more and more confused and not understanding where the truth lies.
Could you forgive Twitter and Facebook for trying to prevent dangerous misinformation and misleading claims? Because there was a lot of nonsense as well. How else do you manage it? You know, they would argue you have to take a line, and if all the governments and the World Health Organization are taking a certain line, then that is the best evidence that they have at the time. And because your views differed from that, or this study differed from that, you know, it's very difficult to sort of control it.
So there's a long history of regulation, governments getting it wrong. Otherwise, you wouldn't need an evidence-based approach. You just say, let's go to the government, they'll tell us what to do, and here we go. And we can go right back to thalidomide, which was approved as a drug, and you go, that's how you get it wrong, and you can seriously get it wrong. And if you don't have people around you who question what the dogma is, you will end up in serious issues. And I can go right through every decade. I can go into the 80s and talk to you about anti-arrhythmic drugs that were used in heart attack patients that in America killed more Americans than in the whole of the Vietnam War. And that really was a pivotal moment when said, look, we need evidence here. And if you don't have evidence, then you've got this problem. So you follow dogma, and you get in a position where you may be creating more harm than benefit. Now, the other thing is, it's interesting that the Science Media Centre has, for instance, come out and said how to deal with the media in the pandemic and what should we do differently. There has to be a respect that in the early development of intervention, that actually there will be differences of opinion about what to do next. As the evidence builds, then the quality of that evidence will point to a direction which says this is how we intervene. And when you intervene, you can quantify the effect. Now, the key difference is if you're a doctor and I am a doctor, so I work as an urgent care GP, I have to express uncertainty. And I teach this to all my medical students. I say, look, you are now perceived as a doctor. If you don't know the answer, you have to express that to patients. You can't make it up because they will take that word and take it as gospel in effect. So we have to be beholden to, here's the evidence, and here's how it informs you what you may or may not do, and here's the benefits and harm, and here's the uncertainties. But there are so many people contributing to the pandemic who don't want to express uncertainty. They want to give you the truth. And in giving that, it creates a reassurance. It's all, look, we've got a highly new disease. It's really infectious. It's killing people. I have a nice, simple answer. How about you go about this? But the reality on the ground is there's much more uncertainty. Now, in the midst of this, when people were highly anxious, they wanted more certainty. As we're coming out of it now, as I said with that statement earlier on, people are reflecting back and going, hold on a minute. What happens if we were telling 70 or 80-year-olds it was fine to go down the shops, so long as they wore a mask, they would be safe? Now, I'm posing the question saying, is that the best advice? Is it safe? And what happens if it's not safe? Because many times when we've done the trials, we've shown the opposite to what we consider is a mechanism or our opinion. Now, this is an important point that we are in the midst of with social media, because this is the first pandemic where we faced this huge amount of opinions about what to do next, and here's the answer. Remember, we, throughout this pandemic, have never made a statement to say, here's the definitive thing for you to do based on the evidence. Because if I could do that, I would be able to quantify the amount of benefit you would derive based on high quality evidence.
I mean, do you think then that the whole idea of censorship, should it be banned in academia and in science, because it is actually quite dangerous?
Well, look, I think the first thing is to say it's important for us to get a sense of what censorship is. It's a suppression of speech or other information, and it's generally suppressed by people because you find something objectionable, harmful, sensitive, or inconvenient. You just don't like it, do you? And there are many things where people say, I don't like it. But often I have to live with that. So it could be something political, could be something moral I object to. That's different to stuff that's directly harmful or illegal. So what you see in the problem in social media is you see this disconnect. So you get information where you go, well, surely that's discriminatory. And I saw something from David Baddiel the other day where I thought, I can't even repeat that. That's on Twitter. An attack on him and the Jewish people. I was just like, this is terrible. That's the sort of stuff that you think, how does this get through? And over here, you've got political ideology or opinion about what to do next, which is what we're about as individuals. That's what makes a society able to function, is to question what's going on. And I think it's interesting to see in the societies that do have censorship. So, for instance, something like Wikipedia is in Myanmar and China is taken down because they don't like people to post potentially information that might be sensitive or disagree with the government line. So that's what censorship looks like. And it's interesting to note censorship always becomes an issue throughout the ages when there's particular stresses. So we can see what's happening in Ukraine and Russia with a war, and we've seen this in the Second World War, is a particular censorship becomes an issue because people are trying to manipulate the facts. What COVID did is create a stress that was a bit like a war phenomenon in the social media, in terms of then saying we have to manage the facts and we are going to support the government line, without asking questions and saying, well, hold on a minute, every government around the world seems to be doing it differently. Which one's correct then? Which one should we follow or not follow? And that's part of the problem with this issue. And in terms of coming to a fore, only a couple of weeks ago, I posted a tweet based on an article that we've done, which was an evidence-based article on deaths and how do you define a death. And we found 14 different definitions
A
for a
COVID
death.
death, you mean?
Yeah, COVID death. It was published in the Express. It was published in the Mail. And I didn't even put a comment on it. All I did was retweet the headline of the Mail article. Immediately, I get a notification saying you violated Twitter rules and we're taking this down and you're suspended. And what happened is about 12, 24 hours later is suddenly I'm back on. And I've no idea why I got back on. And it's not clear to me what the issues were. So this can happen to anybody. Now, I'm not worried about myself. I'm worried about the basic principle that actually you can manipulate the facts and information to suit particular ideology, particular morals, or particular issues that you think are the correct things to do. That is a huge problem. One of the areas that's interesting about this is then what is a social media entity? Is it news? Because if it's news, it can have editorial decisions about what it does and doesn't publish. Or is it a social media platform where it's a host for information? And it is the latter because it doesn't want any regulation, but it operates a bit like the press, if you ask me, because it wants to have editorial roles over what is and isn't published. Therefore, I do think, a bit like IPSO, which is the Independent Press Standards Organisation, it's interesting to look at their report on what they've looked at for when people complained about COVID. In fact, the first thing is to say the press has very few complaints compared to the sheer number of articles. Probably about 10% of all the complaints throughout the COVID era, the 2 years were only at COVID. Most of them were other things. Generally, it's about accuracy. But what they do is they have an ability to look at that complaint and say, is it upheld? If so, what should we do differently? Now, this is what should happen in social media, is because it has to be a learning process going forward. It's a tool that's highly valuable, but there are things going badly wrong with social media, but I think they can be fixed. But what you don't want to do is trying to fix them. The problem the new bill has is it potentially censoring what they can and can't do. So I go more for the IPSO model and trying to say, well, look, this is an area where I'd quite like this to be looked at. It's a particular complaint of mine. And can you tell me what happened? Was it an error? If it's an error, what are you going to do differently next?
But given the sheer volume of information that's out on social media, it would be very difficult. I mean, they sort of use a black box algorithm at the moment, don't they? And then when people have appealed, they just get a automated response. You don't get to speak to a person. So the appeal system, which the government says will be part of the online safety bill, it doesn't actually function. So without a human being behind that, I don't know how.
So I'm not sure if it is an automated system. Because I think what's happening in social media is what we see is the amplification of particularly extreme views. And those extreme views sometimes are led by people who don't have to verify themselves. They can be bots. But what seems to be the strategy is to complain. And in complaining, you can report tweets quite en masse very quickly. Because how come if I reported it, everybody else who was tweeting it should have got the same Twitter violation and said, you're being taken down. And there was thousands of people looked at the article and shared it. I mean, it was 1,700 shares. So 1,700 people didn't get violations on Twitter and taken down. One person did. So there must be people amplifying, saying, I don't like their message, so let's target these individuals. And then Twitter responds and goes, we've got complaints. It meets an algorithm. Let's take it down. Now, that particular amplification is censorship because people are censoring ideas by complaining and saying, can you take this person down? So there's a social media censorship that's going on. And in effect, when you think of censorship, what else is happening is, and this is a big thing in academia, is I consider now there's a problem with self-censorship. So what happens when this occurs, and if it doesn't happen to you, but if it does, you suddenly have to withdraw a bit and go, well, what can I publish? What can't I publish? And the people around you go, well, I ain't going there. I'm not going to retweet this article. I'm not putting it out there because I fear for my job. If I am seen by somebody as being on the side of something that's not the status quo, maybe I won't get that promotion.
Have you ever
Maybe I
felt
might.
like that? Have you ever self-censored your work or anything that you've worked
Look,
on?
yeah, so I think it's interesting. When I go back to the Ipso complaints, about 85%, the majority of complaints were for accuracy. And I think that's interesting in the press. It's people got the numbers wrong or statements that didn't meet the facts. So we work incredibly hard to ensure our work is accurate. And that's what really strains us and stresses us out on a daily basis, because we're looking at a lot of evidence. We're using that evidence to make statements. So therefore, it has to be accurate, that flow. And that's where we put most of our effort. And what happens is that never becomes, so nobody comes back and says you made an error. What happens is they come back at you and say you're a public health threat because of the messaging you're putting out there. So they attack the messenger, not the message. And in doing that, you then tend to, there has been times where I've gone, particularly certain times when you mentioned the website that was coming out there and some of the government stuff and some of the newspapers that were coming after me. I was a bit like, this is too much to handle right now.
Talk a bit more about that. There was an MP, wasn't there, that tried to smear you and other critics of the government's approach on Twitter, the government's COVID approach on Twitter. They had a sort of antivirus COVID group. And then some of your colleagues were labelled as charlatans and snake oil merchants by other academics. So that's is that a relatively new phenomenon? And why do you think that happened?
I think it is a new phenomenon. You're right. There was a website put up. There were certain people in government, some of them who've gone now, who said, like Dominic Cummings was one of them, who said we was a particular problem because we met with the Prime Minister and expressed views. Their particular information is twisted. And it's interesting to note that people will write about you and what you said and won't actually fact check it anymore. They'll just have a viewpoint and then twist the facts to suit. And I think that's been quite revealing over time, is that when you go into the world, you're aware that you get into this certain level, people will use some of the information and distort it. And I found that particularly a problem, but it's something you've got to really think about then. So now I'm very much try to be more articulate about the things I do say and don't say.
Have you got a specific example of where anything?
Yeah, I'll give you an example. BBC Nick Triggle asked me in September 2020, he said, look, cases are going up. And I said, yeah, they are going up. But you've got to remember, Nick, we've just started testing for the first time at masses. So nobody's got an understanding where they're coming through summer. And when we get into September and October, viral pathogens will go up because as we return to school and seasonal effect, we'll start to see some of the other viruses like rhinovirus, adenovirus, and coronavirus all at once coming at you. So the fact you're seeing on the government data board that's just been established, cases are going up, could be, you got to think about it in the line of the testing. And I said, you could do some maths on that and look at that, and particularly look at what I call is the PCR positivity, because that's helpful. It's a much better measure now as you're reducing your testing than the number of cases. But then second, he said, so are we in a second wave? So I said, well, it's interesting. How would you judge a second wave? Where's there a definition I can look at? Because if it's cases, we have no idea. I said, what we do is look at excess deaths. And so if you go back to the beginning of the pandemic, you'll notice in about April, the first week of April, the excess deaths went up, and for about 9 weeks, they came back to normal. That for us is the first wave. And we do that with a particular measure looking at 2 standard deviations away from the normal. So we haven't just sort of made it up. We thought about this, and nobody else has a rational approach. So I said to him, look, if you look at the data today, what you'll see is there are no excess deaths. And so on the measure of what I've just discussed, the second wave for me would be when you get excess deaths above 2 standard deviations of the normal. That'll be the second wave. The headline is, Heneghan says there's no second wave. And that's how it gets completely shifted in a way. And you go, I haven't said that. I've just said to you, here's a definition of how you might look at it, and here's how you might think about it. I still think that's a valid definition. But if I go on social media and say Heneghan, who got it wrong, said that, and then they go projected in time and say there'd never be a second wave. Well, I never said that, because actually with the government, when I met with the government, I said, this is how the seasonal effect will look, and here's where it's most likely to be a problem for you, which is with most respiratory pathogens in the northern hemisphere, is December and January. And that's when we get into real problems. Either side, you can get into problems, but that's when we have a real problem with hospitalizations and deaths.
So have you ever seen a period in history where academics and even MPs and other sort of people in the media were so prepared to attack and try and close down debate? Why do you think this happened? Do you think it was due to fear or?
So there's a very interesting, you're sort of trying to compress a timeline of events over the last 2 years into a discussion. But we've got to think about some of the things. What happened in China had a very big impact on what happened very early on. Then there were new information, new bits of data where everybody wanted to say, here's a reproduction number. Oh, we've got to keep the R number below 1. If we do that, we'll be all right. It'll disappear and we'll be back at work. And what happens is politicians grab these initiatives and these ways of speaking very rapidly without understanding and interpreting the sort of biases, the significant problems that comes with that approach, because it feels intuitively useful. Let's get the R below 1. We'll all be safe. So if you remember in November 2020, we were talking about going back to the workplace and everything will be back to normal. Get the R below 1, we keep it there. That's a zero COVID suppression strategy. And we wasted a lot of time because people thought, just like a bath, you could turn the tap off, let the water drain out, and everything would be all right. Couldn't have been any further from the truth if you understood the sort of vagaries of respiratory infections in the community. Now, have we had this position before? No, we certainly haven't. But I think throughout the ages, scientists have had significant impacts on the direction of travel, haven't they? And certain innovations, whether you think about things like the nuclear bomb, that's had a big impact on politics and what happened. So science has had a big impact. What's different this time is they have a platform which is not journals. They've tended to come to the media, and that's a radically different approach than previously. We would have normally gone in, say, the swine flu pandemic through the journals, published in the journals, and then escalated to the media. But now that's been transcended. And I think there's a huge appetite in the media and the news for healthcare information. I think that is positive. The question is, here's what I think is interesting. I think what should be pushed is more journalists who have expertise in healthcare, because I think that's radically needed. And I'll give you a good example of why. I mentioned the thalidomide. Well, if you go back to the thalidomide, it was the Sunday Times who looked at thalidomide, and it was Harold Evans was the editor at the time, and he had about 100 journalists on it. This was in the good old days when there was money flying around and you could put people on the story for 6 months and dig and find the data. That needs to come back. And I actually think, and I think there should be, and I'm aware of this in other countries like Holland, a pot of money that the government provides for journalists to be able to look at and scrutinize what's happening at regulatory government level. And that allows people to spend longer time investigating these issues and uncovering what the truth is. That's good for democracy and society. But at the moment, we're in this sort of clickbait world where we're very uncritical, and it's the next headline and we move on. And that's one of the problems.
So the safety bill, which is proposing to make the UK the safest online country in the world, will perhaps mean that there's even more stuff taken back down. And do you think that will continue to sort of, what will that do for science, do you think, potentially, in academia?
So I think we're in a world where there are obviously certain issues about a safety bill that have to be addressed. So, for instance, something like pornography, you can just sign up as a child now. You don't have to verify anything, and you're in and you can get access. And you're like, there's something really strange about some of the issues we put forward. So it's a bit like going into a shop You have rules and regulations about what you can and can't do, can't you? So you can't just display it in the open. And so I think there are bits where we have to be thoughtful. I think there will be problems comes with the safety bill, because you have this problem where you're worried about particularly censorship going forward, because people will use it politically to say, well, actually, I don't like this content. That's the sort of content we should take down. But I do think there is a position of safety is needed. And in doing that, we have to be mindful, again, that some of the things we do will be beneficial, but some will be harmful. And there has to be a mechanism for how does that get regulated to not stop this online censorship that everybody's worried about, because you use that this is unsafe material, which you could basically say about lots of the things we post if it's in a public health arena. But let me tell you, the thing about evidence is most interventions, even those that actually proven to be beneficial, only offer a tiny benefit to what's already existing. Every now and again, a new intervention comes along that does offer a big benefit, but most only offer a small benefit. And many are no benefit or harmful.
So for example, my job, drugs, you might say the numbers needed to treat using one particular drug will be quite a lot of, you need to treat a lot of people to get some with some benefit. It's not just like a black and white.
Yeah, I'll give you an example. So if I use aspirin in a heart attack, it's a highly efficacious treatment that actually reduces mortality at about 30 days. And for about every 40 people you treat with aspirin, you save one life just in the 30 days. However, if I use aspirin in what's called primary prevention, that's people who are at risk of a heart attack, the harms outweigh the benefits because they're more at risk of a bleed. And if you have aspirin daily, you can get what's called a gastrointestinal bleed. And those harms outweigh the benefits. So we don't use it in primary prevention, but it's in secondary prevention. The evidence is clear. There's over 200 randomized controlled trials for aspirin. Now, if I was to put a statement out there that said aspirin is of no benefit in secondary prevention or in a heart attack, I'd be going against guidelines. I'd be going against the profession, and it'd be right for me to take that information down because it's misinformation. But if I put it against primary prevention, it's information, it's helpful information. The question is, who has the skills to understand and interpret what I've just said? Because what's happening with these fact checkers is that people out of a science degree who basically just would not even understand the nuances of what we've just discussed.
Who are the fact checkers?
The fact checkers tend to be organizations that receive funding and then employ graduates to just say, go and fact check this. It's a way of, I consider, it's one of those smoke screens to say, we are protecting you. You ask me a fact. I don't say, here's what I think. I go, here's the evidence. Here's the quality of that evidence. Here's the bias, and here's the effect size. It's up to you to judge whether that's correct or not based on the quality of that information. Now, the problem is well, not the problem, actually, maybe it's something that's been beneficial throughout this pandemic, is people in the last 2 years are realizing how important the evidence is in the decision making. So, for instance, if you have a test and trace program that you roll out there and it's going to cost you £37 billion, somebody's got to pay for that, and we as taxpayers are paying for it. And you really do want to ask questions about how effective it is. Given the fact it's never been tried before, we would generally say what you need to do is do randomized trials. And you do that as a cluster. You could go in, one area has the intervention, one doesn't. And over a period of time, you can look at the outcomes. You could do that really quickly. You could even do that now. But we don't want to answer these questions. And therefore, it comes down to my opinion. Well, if you're wasting 37 billion, surely you would want to know you're going to get a significant effect size. And if you look what's happened, you really have to ask questions about whether it's made a difference or not.
Well, the argument always is we're in unprecedented times and we cannot wait and we don't have time to do all that. So I suppose that helped polarize debate. And, I mean, how much do you think the government informed the debate really or helped with the keeping censorship going during the pandemic?
So let's but this is an important point, Lisa, is the job is to make us think and provoke ideas. So let's look at care homes where 30% of the deaths occurred. What the strategy was, let's keep it out of care homes. And in keeping it out of care homes, you keep the cases low and the mortality low. However, 30% of deaths occurred in care homes. And number two is you never kept it out of care homes because more or less every care home in the country has had the infection. The second option is to say, well, actually, it's going to get into care homes, and that's what the evidence shows. And higher quality homes could keep it out for a bit, but actually couldn't keep it out forever. So it was going to get in there. Or you could decide to put all of your strategies in the home. So you could put more nurses in there, more doctors, more support. And if you do that, all the evidence points to you get lower mortality. The problem is the former is a big business and lots of money to be made and feels like you're doing something. The latter is nobody makes any money. You have to resource the care homes better and you have to put a lot of funding into that area, but nobody's going to make a huge profit out of that. But the patients are going to get better care. I would have done trials to say, can we try out the second approach, please? Because every time I go in a care home, and I was in one last night when I was doing my urgent care job, there were 60 residents and there were 7 staff in the evening and overnight and 1 nurse out of that 7. And to be honest here, it's not enough because one of them patients has a problem, as they did last night, that will tie up 2 to 3 members of staff with myself as the doctor for half an hour while we're trying to work out what's going on. I'm doing things like, here's what we're going to treat them with, here's how we're going to go about it. So you tie them up. There just isn't enough resources. So I'm saying there are different ways to manage this pandemic that are completely at odds with the public health strategy that we've got in place. For that, you may get censored.
Yeah, that's what I was going to say. So you saw it differently, had different ideas about how we may manage it. Do you think the government had a hand in keeping information like yours out? And how did it do that? Did the government censor information?
Yeah, definitely. Because I think what happens is it's this ideology is really important and it's difficult to manage. People had particular views about how to manage this. And it was generally around the suppression approach and what was happening in China. In doing so, they said anything that goes against that viewpoint, we have a difficulty with. And then let's get rid of those opinions. And I had discussions many times with the government. I even at one point went in and red teamed some of their analyses and basically sat there and said, look, this is how you might look at it differently. And I think what I found was a lack of what I could ability to embrace uncertainty. And that embracement of uncertainty reminds me when I've got new trainees and they come in to see people who are really unwell or a child really unwell, and their only answer is, let's refer them into hospital. So I'm like, hold on a minute, we are going to overwhelm the hospital here because everybody you see as a child with a fever, you've got to go in hospital because you think they've got meningitis. But what that does is, in a highly uncertain situation for yourself, manages your anxiety by saying, here's a simple solution, let's pass on this over there. Most of what was happening is, if we suppress this virus, we get rid of the problem. That manages my anxiety. So it was inexperience and a lack of expertise. And I think that was the crux. And that expertise is about what's happening in the community.
But how did they censor you? How did they keep your views out? Was it more of a passive, sort of by not listening, by not taking it on, by just promoting one idea and listening to
I think most things changed around about January 21. And I think there was a particular viewpoint in January 21 where things became much more political, opinionated. That's when all the censorship, all the complaints, all of the issues started to arise. Because I think people felt that they should have had the suppression and the simple strategy. And some people were getting in the way.
Against you and against others, lots of people.
Yeah.
Did you find that you had sleepless nights, and did it really affect your kind of,
I think people are gonna, I always look back to my late father when we talk about this. It was a tremendous amount of support to me, and it was just he was a plumber, just a very calm, cool guy. But he taught me a lot of, the simple things that you come through life, and you know, he had a load of statements that I just keep going back to, you know, he used to say empty vessels make most noise. And, you know, and you go back and you go, yeah, I get that. There's a load of people shouting out there. They're the empty vessels. And, you know, and the old sticks and stones will break my bones. And I was like, you know, yeah, this is really true. These things you get taught as a kid. And you get in the playground and you go, one day you go, these are really important issues.
Do
To
you
be
ever
honest,
feel like giving up? Did you just
no,
think, what's the point?
no, no. Well,
Because it was for no, you didn't earn any money, you didn't earn any accolades, you weren't getting, you know, sort of day in the sun, you know, a lot of, I mean,
well,
scientists.
just to be clear, we get a few pennies from the Spectator when we publish with the Spectator.
But,
It's
I mean,
not enough.
big bucks. It's not. It's
No,
not like big grant funding. But what I mean is, it was not much in it for you. You know, to put your
no.
head above the parapet. It wasn't like you were getting anything out of it except for grief at that time.
Yeah, I'd say yeah, but also just to say, I did get a lot of grief, but also I got a lot of positives.
Yeah.
I have to say the positives were far outweighing any grief.
Yeah.
I did get a few bottles of whiskey, so I have to declare that as a competing interest from people just saying what you're doing for us in the hospitality sector is amazing. Just trying to get an alternative view. Lots of the public going, you just present a balanced sense of view. So the public, yes. Academia, no, because I just think there's a lot of people who were highly anxious in that arena. Not all, some. You're right. But I didn't lose sleep, Lucy. And I'll tell you why. I did get to the point where I'd have a few days where I just go, and when that happens, I tend to step back, take a break, just a few days, and then come back. I do never react. And I think what we see in social media is this is the number one rule. If somebody says something to you and it makes you feel a certain way, you should not then go and react. Because that's where you make mistakes. And that's emotional intelligence, isn't it? You've got to feel things, spend a few days and just say, right, I've rebuilt and got rid of all that angst and anger. I'm now going to come back. And I think the emotional intelligence and not reacting is incredibly important.
Yeah.
So one of the things, I say this with emails, if you get a rejection or something in an email, just send the email you wanted to send to yourself. And when it comes through and you read it and you calm down, you go, bloody hell, I'm glad I didn't send that. And it's the same on social media, isn't it? People are making mistakes because there's no pause button. And I like to think people are better than what they are. But the problem is social media, there's no stopping you just going immediate emotional reaction. And that's what's happening from members of the public who are generally frightened and scared and anxious. And I'm okay with that.
So back to the government's online safety bill, you know, trying to make the UK the safest place in the world. They're going to try and regulate illegal and legal harmful content. So, and the Secretary of State will be able to decide what's harmful content. There are sort of caveats around politicians and around news media, but no carve out for academics, interestingly. So do you worry about that? And do you think, you know, it's just sort of ratcheting up censorship into the public policy debate possibly and into science? You know, what do you think the potential is there? Because effectively Nadine Dorries will be able to decide, you know, have a monopoly on the truth about things, and then Parliament will be able to nod it through. It's secondary legislation that will, if this goes through, nod through what she decides.
So, but prior to that, there's an education bill that's now coming for its third reading, which is about academic freedom of speech. And I think that's interesting that we've had to bring that to the fore to reaffirm freedom of speech in academia. I perceive and hope that's why they're not covering it in, because this is what it says. Point 6 in the bill says, in this part, academic freedom in relation to academic staff at a registered higher education provider means their freedom within the law and within their field of expertise to question and test received wisdom and to put forward new ideas and controversial or unpopular opinions without placing themselves at risk of being adversely affected in any of the ways described going forward. Loss of job or privileges at the provider, for instance, or securing promotion.
But even on social media, do you think that will...
Yeah, because I think what that does is you actually, if you are basically putting people at risk of being promotion because you're censoring, I mean, you're going, hold on a minute, I've just put forward a controversial opinion that in the education bill, as an academic, says that's my right. In fact, it's my job. That's the biggest issue. And I think this is
But does
this.
there's been many doctors, I know a number of doctors who've been removed from Twitter and they can't get back. So they're in permanent Twitter suspension. So despite the fact that what they've said they believed was correct, is the system, the framework within the social media sphere good enough to incorporate academic freedom?
So I think you make a good point here. There's a distinction between academic freedom and what people are doing within organisations like the NHS, where they will not be covered by this. Because
Right.
I am at the
Oh,
University
yeah.
of Oxford, so I'm covered as an academic, and I have a job where I work in the NHS, not the other way around. So
Despite
I don't
that,
know.
you got censored and
Yeah,
warnings on
yeah,
you. So,
yeah.
I'm not sure
So,
how.
but this is, I am aware and contacted by many people in the NHS on a regular basis. Many of them have important issues to say, but are too scared to speak out. I can tell you in the very early days, I was aware, contacted numerous times by people saying, for instance, the government is telling us nobody is being discharged from a home with COVID to a care home. And they're going, I've just dropped somebody off at a care home as an ambulance driver with COVID. When we got there, we had full PPE. When they went inside the door, the person had no PPE on. And he said, because we haven't got it. And I'm like, this is important and vital information that needs to get into the public arena. But people are too scared to speak out because they're worried about losing their job or privileges within the NHS. And there is a bit of this culture that emerges in many areas I've worked in, where you
Yeah.
go into defensive mode. We need to defend the organisation so that we don't get found out if we made an error. In fact, the culture is the exact opposite. What you want to do is say, look, bring us your complaints, bring us the issues, and we'll listen. We can't solve all of them, but we will listen and think about how do we improve. I think this is an incredibly important issue that needs to move forward in the NHS. And where does it get to the really bad? You get these hospitals where you see all the baby deaths because people were too scared to speak out. You get loads of problems sometimes with certain innovations like mesh, where people are not coming forward and saying there seems to be a problem. And one of the key things about evidence-based medicine, and we'll get there in the end, the question is how many people will be harmed on the way. I think the culture should change, particularly in the health system. And I think there should be something within this organisation, that a health freedom of speech bill that says, we need you to improve the service. I can tell you there are loads of people on the front line who would probably come forward with good ideas saying there's a problem here. And the issue is most people think you're complaining when you're highlighting a problem. And so they don't want to see it. So that cultural change would allow people to come forward in a much...
Could it also be, crippling to the NHS to have to accept lots of blame? And, we have a very litigious...
Well, I'm aware of people who've gone on Twitter and social media and have gone under pseudonyms as NHS doctors or people in the NHS, and have used pseudonyms because they're so concerned about being seen or speaking out. So I think
What
I
actually
think
happens if they do speak out? Do they get the communications team down? Do people
all sorts of
actually... Yeah,
all sorts of potential. That's happened with people I've worked with. They've stopped working with us
really? They lose their
because
job for complaining. Yeah.
because they're too concerned about their job. And I think, this is the problem, is as we get older and accrue more stuff, if you like, children, mortgages, your responsibilities go up, don't they? And so you become more risk averse and you become more aware. And in that, you become self-censored and you go, yeah, this is the right thing to do. But actually, I can't do that because I've got too many responsibilities if I lose my job. End of.
Have you, how would you fix Twitter and Facebook? There are people that put out misinformation. There are people that do things that could be harmful. We had a pandemic and people are putting things about, drinking bleach or whatever it is. I mean, how do you fix that? There's too many people posting to monitor everything. So is there a better way that you can see to do it?
So either you're a platform or you're not. So that's the first question. What is Twitter? If it's a platform, then basically it's just like you can put your ideas into the shop, if you like, into the social media window. You have a very clear policy about taking things down that are discriminatory and illegal. So that's the first thing you've got to do.
And you think that's possible to read?
Yeah, but
Is
the
that
problem
not
is
subjective itself?
yeah, but here, if you then decide you have editorial function, I think you then should be moving into the news arena, and you're starting to become, we need regulation. And that regulation should come in a bit like what the news has done. Because I think the news has to pride itself on accuracy and accuracy of content. And in doing so, that self-regulation has to ask, this is not going to go away. We're in the very early stages of how to use it. But actually, we do need a process that says we are a learning cycle that says, here's what's acceptable or not. There are lots of people I disagree with, but there are things like in political arenas where if you decide you want to censorship people based on their political affiliation, we've got a big problem then. So I before we get to the health, I think we've got to sort the political issues out, because as it comes to election times, if these big techs have an ability to distort what happens next in terms of who and we vote for, that is a huge problem. And I think that has to be sorted before we come and attach it to, because I think the healthcare and misinformation, I would say these are not platforms. These are news organizations in some format. And in understanding that, you go, well, yeah, we're going to have inquiries to look at what we do in terms of regulation. That regulation will probably start from self-regulation, a bit like the EPSO model, where they start to look at these issues from an independent viewpoint.
But then, during the pandemic, it could have been decided Ofcom's going to look at Twitter, if the online safety bill goes through. So Ofcom could say, well, I think masks are essential, and they could have taken down your mask analysis. So, I don't know how you, who decides what the truth is if you're regulating it at all?
Well, look, we do that in standard ways in healthcare. Mm-hmm. We've got NICE. We do it in NICE doesn't come forward and say, I think this is the case. They come forward and say, here's the evidence. And with that evidence, here's our recommendations. And those recommendations will have a rating system. Actually, they're based on high quality evidence. They're based on opinion. Well, if they're based on opinion, they'll have recommendations to reduce the uncertainty. Mm-hmm. That's quite simple to do. But what you can't do is say there are authoritative opinions in bodies. Now, if I am practicing medicine, there are easy ways that I can be reported to the GMC for being unsafe. And it would be, I'm doing things that are going against high quality evidence or high quality national guidelines, and against what the majority of my profession consider is the right thing to do in this situation. So as I've said before, in terms of he didn't give the 10 patients who came through the door aspirin with an MI, they go, well, he's unsafe. But there are many other situations where the uncertainty might lead to differences of opinions and differences in how this patient's treated. That is okay, and that's the problem is that stuff will be taken down if there isn't a clear policy about what constitutes evidence or information. And to be honest, it's quite straightforward. It's called an evidence-based approach, not an opinion-based approach. And if you had an evidence-based approach, you'd write very clear types of evidence that can be used to inform judgments. So
Twitter was only trying to use an evidence-based approach, but the problem is we didn't have the evidence base to...
No. Remember when the reason evidence-based medicine came about is because we predominantly use an opinion and authoritative opinions about what to do next. So you could have a group of people in a room and say, we think this is the right thing to do. And it would predominantly be based on mechanisms or on hypotheses or small bits of data. And that was unacceptable because there were too many people being harmed. What you did is define types of evidence in certain situations, like you'd want randomized controlled trials for vaccines or drugs. Now, can you imagine what would have happened if we hadn't have had an evidence-based approach in this pandemic for drugs and vaccines? It would have been a complete free-for-all. We wouldn't have discovered, for instance, in the recovery trial that dexamethasone has a significant impact in people with COVID on oxygen. We wouldn't have understood the benefits of vaccines that required randomized controlled trials. We would have understood that some of the drugs that were actually didn't show to have a benefit we would have carried on using them. So people would have been arguing across each other about how to treat patients. So we have established mechanisms with drugs and vaccines of the type of evidence, and you don't get the same problems, do you? You do early on, but as you evolve the evidence, you go, actually, we get nearer to the truth.
So the non-pharmaceutical interventions, the things that we did in the pandemic that weren't drug-based, the masks, the social distancing, the perspex screens, all the measures, the stay-at-home orders, you're saying they weren't evidence-based, and we still haven't done randomised controlled trials really on them, but yet we still treated them in the Twitter sphere and in the social media sphere as if they were fact. Is that what you're saying?
Well, I'm sure everybody has their favourite for which they looked at it and said, I can't quite weigh that up. Like if you couldn't close pubs at 10 o'clock as opposed to 11 o'clock, you're going to have a rule of 6. So I could go now and see my sister who's got 5, and then I'd come home and then my wife could go around and see them, but we couldn't see them together. So you just you look at some of the rules and you go, well, who's making this up? What they're basing it on? And how are they bringing that to the fore? But you're right. Non-pharmaceutical interventions are just as important to study as drugs and vaccines, because people go, well, they don't harmful. Well, they can be harmful in all sorts of ways. So if you tell somebody there's an intervention that makes them safe and they go into the world and actually they're not safe, you are creating harm. Now, that wouldn't matter to a young person because their risk is low. But what happens if you're an 80-year-old? And there are many things you could have trialed to try and understand whether it improves the outcome, particularly for the most vulnerable.
Why do you think there was so much vitriol? Why was there so much suppression of things like mask data, that you tried to highlight, other sort of studies? What made people so passionately standing in the corners? Do you think
so? There are a lot. Yeah. So most of what I've seen is, when people do that, is they be coming from a position of, I think this is the right thing to do. And we're almost primed in life to be like that. When you go about in your daily life, look at the amount of people who are giving you opinions and advice about what you should and shouldn't do. Now, to be honest, I'm a bit of a nightmare at parties because I will just go, can you tell me where the evidence for that is? And my wife will tell me to shut up and, you're going to annoy everybody. But that's what I do. That's just a fundamental principle of my job. We've done it in so many areas. In areas where there have been significant harms, like I said, like metal hits or transvaginal mesh, we've gone and looked at the evidence and gone, it doesn't stack up here. There's a real issue. Now, once you get that understanding, it means you're actually involved in decision-making. So we're all very good about telling other people what to do. But when we make decisions for ourselves, you really want to be informed, don't you, about the benefits and harms of that intervention. So when you see what I consider as an expert doctor, he lays it out for you, tells you about here's where your benefits are going to come, here's the potential adverse consequences, and here's the sort of issues you might consider when making a decision about what to do next. And in prevention, that's incredibly important because you're trying to prevent something that is happening some point in the future far off. If you understood that, if more people understood that and put themselves in trying to inform decision as opposed to tell people what the decision is, they'd start to think differently about the type of evidence they want to put forward to you. And I've spent 30 years trying to inform decisions. And what's been interesting about that is how incredibly controversial it can be when you try to inform something, because what people do is form extreme opinions about what the right thing to do and often shut down from the evidence because they don't want to hear it.
During the pandemic, for the first time, we saw academics on television virtually every day, and some academics became very well-known faces. Do you think that sort of contributed to the shutting down of certain debates and the whole idea, the whole fierce polarisation of how we should manage it?
You see, I think, look, the first thing is when I listen to everybody, even though I might not agree with everybody, we're all trying to get to the same point, aren't we? Everybody wants to get to a point where you can get back to freedom, reduce morbidity and reduce mortality. They just have different opinions about how you get there. And that opinions can be based on bits of evidence, real world data, or actual real world practice. Now, one of the key issues is that if you put these people, you listen to them, you think they're polar opposite. But actually, if you put them in a room together, they'll probably think, they'll probably start discussing it and probably come to a more of a sensible viewpoint. So I think what the media has to do, and this is the problem, is you don't want people arguing across each other. It's beneficial to try and get people in a room to try and say, look, how do we get from A to B? But unfortunately, different bits of the media have their political editorial roles where they say, well, I'm over at this viewpoint and this is where we're going to push, and we're over here. And I think from an editorial at the top, it's important to try and understand where the positions are coming from so that we can move forward. Because I would say there's a sort of middle ground. And my point is, I can inform decision making, and people can go off and do the exact opposite to what I consider. And that's okay. The question is, are you fully informed? And in doing so, I think that's the major challenge for people in the media, because what happens is, and this is key, everybody wants that soundbite for which you'll be leading the news. Heneghan said you should lock down or do this or do that. So it's trying to understand, and I think that's one thing I've learned throughout this is, if I say that, this is what's going to be taken forward and used in a way to be the headline. And I think that's where you have to be thoughtful. And I think that's the key. And I think, there's been times when people have said something, I'm like, that's going to be in the major news and that's going to have a wider impact on society. And it would have been helpful if you didn't say that. You could have toned it back. And I think that's the key. You've got to be clear about your messaging. However, to some extent, some people are real masters at that, I think, and they understand that's going to happen. And I think they use that in a way to go, I understand this is what's going to grab the headline.
So, in fact, some people manipulate the media or social media to increase their influence. Do you think that happens?
Yeah, I'll give you an example. When people, for instance, in last Christmas, in when we talked about the emergence of variants of the Alpha variant, they said it's more deadly than anything we've seen before. And the news was leading with that Christmas we're going into lockdown.
Some scientists thought it was more deadly, not all
more deadly. My question is to go, well, where's the evidence for this? And it's like, it's irrefutable. The problem is, I turned up at work on Boxing Day. I work in urgent care on Boxing Day. It's just one of those things I've done throughout my time. And normally it's incredibly busy. There's like 120 people on the phones at 8 a.m. There's 10, 12 visits, and there's loads of people coming in the base because they put it all off from Christmas Day, and then there's a surge. I go in that day, I've literally got my feet up. It's completely quiet. And it's people have gone, well, it's more deadly, and actually has an impact on how people behave. So in doing that, they stop coming forward. If they do come forward, they want an ambulance to take them directly to hospital. So there are 25-year-olds, you're like, you're going to be fine. They're going, no, it's more deadly. I need to be in hospital. So you overwhelm hospital services. So the media, I think, is interesting. In a social media world, actually, you would say with the expediency you get information through our phones and the way it's portrayed and amplified, those messages are actually what the media does, more important than ever.
Yeah.
But we also know what happens with that is they're the information that everybody clicks on. So we're in a bit of this world where people will go for the messages of doom. It creates more people to look at it, but it has a profound impact on society's behavior, which I'm saying a lot of it is not good because it stops people actively engaging with healthcare when they should, or other people going and actively engaging in the wrong way because they think they're about to die. And that had a huge impact, I think, on what happened in the next few weeks over January in that time period.
So there is a call for kind of, proper peer review or a proper academic process, perhaps now, before before data and preprints are kind of pushed out. The kind of need for censoring that, really.
You say I'm okay with what's happening. I think there's a huge benefit to transparency of putting information and evidence out there. You just have to be more critical, more thoughtful, and more analytical. It's very difficult to create a statement about intervening in healthcare based on one or two bits of information, you generally have to build that evidence base. And in doing so, you can then be more definitive about what you do and don't say. So if you're going to make a statement that it's more deadly, people should start to say, well, what type of evidence do you require to be able to say that with, and journalists should be, this is the bit of the expertise, be able to say, hey, hold on a minute. You seem to be making this on a small case control study that actually is not being even peer reviewed.
So is there one piece of advice or one tip about how you would want to, how you think we should interact, academics should interact with the media?
Well, look, I think it's, look, Lucy, for instance, one of the things is not just by chance we're talking here today, is that we've been talking for years now about the issues. And I think creating a relationship with journalists is an important aspect of what I do in my job, helping to inform the public. More than half of what I do is just helping and thinking these are the issues, or this is something you shouldn't write about, and here's why. And I think when I do that, I think about the public messaging. And so it's not about crediting back to me. It's more so if this is an important thing that gets out here, something good will happen. And I think creating them relationships is incredibly helpful and important. I've learned loads about what's important in the public arena, what matters. And to be honest, you're from a university academic. Isn't that the function of the job, is to be at the forefront of helping the public understand research, understand the science and the evidence. And so I think it's been really interesting to create those relationships and continue to work in that arena to try and inform the public. Yeah,
well, there's some really good people like you that really do help, and we couldn't do our jobs without you. But I think, sorry to say that I think some are, a bit afraid of the media and for fear of being misinterpreted or getting that wrong headline, and others who don't feel the same. But it is invaluable. So yes, thank you so much for joining us today. It's been absolutely fascinating, and I look forward to the Q&A, which will be happening shortly, where people can comment themselves and ask you questions.
That'd be interesting.
Yeah. Okay. Thank you.